Today I'm going to talk about the three different types of skin cancers, some more malignant than others, some more common than others. Some of you might know Bob Marley, a famous reggae singer. He was diagnosed with a melanoma that was found under his toenail. Bob Marley, of course, because of his religious beliefs, refused to get his toe amputated. Now, later on, years passed and it metastasized throughout his body and eventually killed him at the age of 36. I've been working in dermatology now for the past 2 years, half of which I've been helping out in most surgeries, which is a type of surgical procedure that removes skin cancers. So to start off with, we're going to start off with a skin cancer that is called basal cell carcinoma. Basal cell carcinoma is probably the most common type of skin cancer, which usually appears on the skin as a dome-shaped growth. Shiny, it can be pinkish, like a pinkish patch, or it can appear as a sore. The lesion or growth, it can heal and then come back. It will always come back. Now, some lesions may look like this picture here, although not all look alike. This is one of the basal cell carcinomas here. See, it has a shiny kind of pinkish color to it. And the treatment options for this, according to the American Academy of Dermatology Association, one way to treat a basal cell is by performing an excision, which is cutting out the skin cancer, as well as an area of normal skin to make sure that you got the entire cancerous area. Now, this is sent to a lab and it's examined under a microscope. Secondly, there's Mohs surgery, which is typically used for certain areas of the body, like typically the face. We'll do it on the ears, stuff like that. The goal with Mohs surgery is to remove only the necessary amount of skin needed. Now, in turn, that leaves you with a smaller scar. And that is why we typically do it on the face, because most people don't want a big scar on their face. And lastly, there is a procedure called curettage and electrodesiccation, which consists of scraping the cancer with a technique called curetting, and then a procedure called electrodesiccation, which is used to destroy the remaining cancer cells with heat. Second most common type of skin cancer is a squamous cell carcinoma, which can appear on the skin in a variety of ways. Squamous cell carcinoma can appear as a crusty, rough bump, flat red patches, dome-shaped bump that grows and may bleed, as well as a sore that does not heal. Some squamous cell carcinomas can look like this. It's like a rough, crusty, pink lesion there. It appears on sun-exposed skin, such as the face, ears, lips, back of the hands, arms, and legs. Some squamous cells begin as precancerous growths. So these precancerous growths can look like this, and these are called actinic keratosis, which can share common qualities such as being dry, scaly, rough textured. Now, when detected early and treated properly, a squamous cell is highly curable. But if postponed, it can spread to other parts of the body. Surgical treatment options are very similar to treating a basal cell, as discussed on the website skincancer.org under the article Effective Options for Early Stage Squamous Cell Carcinoma. It can be treated through an excision, where the doctor cuts out the cancerous cells plus a certain amount of normal skin, which is then examined under the microscope to make sure all the skin cancer was removed. Another way that it can be treated is with cryotherapy, which uses liquid nitrogen to freeze and destroy the tumor, which eventually falls off, and then eventually you have healthy skin. Although squamous cell and basal cell are the two most common types of skin cancer, they are not the deadliest. Now let's talk about what Bob Marley had. Bob Marley had a melanoma, which is the most deadliest form of skin cancer, which may develop on normal skin or an existing mole. A new growth that does not match your other moles or that looks very similar to them. Now, melanomas can develop under fingernails or on toenails, or like Bob Marley, it grew on his toe. Now, according to the Mayo Clinic, The doctor needs to determine the extent of the melanoma, which will then determine what treatment they will proceed with. Determining the thickness, which can be done under the microscope, seeing if the melanoma has spread to the lymph nodes, which can be examined by a procedure known as sentinel node biopsy. Second, looking for signs of cancer beyond the skin, which can be further evaluated through x-rays, CT scans, or PET scans. For small melanomas, they can either be entirely removed through the initial biopsy and require no further treatment, or through a surgical excision, which includes the cancerous skin as well as a border of normal skin around it, and as well as a depth of normal skin under it too, to make sure that you removed it all, which of course is then sent to the lab and examined to make sure 100% that it's gone. Now, if the melanoma is more severe and has spread beyond the skin, some treatment options may be Mohs surgery with additional radiation therapy or chemotherapy, depending on how severe the melanoma has become. Other treatments involve immunotherapy or targeted therapy, which are different drug treatments to fight the cancer. In summary, the three different types of skin cancer are basal cell, squamous cell, and melanoma. If we're self-examining our own skin, we should consider the ABCDEs, which are A for asymmetry. Does one half look like the other half? B for border. Does it have irregular or poor defined borders? C is for color. Is it all the same color, or does it look like, like a dark brown and then like a light brown? D is for diameter. Is it bigger than the end of a pencil eraser? And D is for evolving. Has the size, shape, or color changed over time? Now remember that anyone can get skin cancer regardless of their skin color. I hope this information is helping to bring light to skin cancer awareness and provide more information on the different types of skin cancers. Thank you.